Good afternoon. My name is Megan Erickson, and I'm a research analyst at ADAPT. Dr. Diana Fishbein is a senior scientist in the FPG Child Development Institute at UNC Chapel Hill, directing the Translational Neuroprevention Research Program. Her 35-year-long career includes deep expertise in the field of substance abuse to determine impacts of harmful social contextual factors on brain development and behavioral and mental health in children and adolescents. Dr. Fishbein's research aims to determine effective means of disrupting pathways to substance misuse and dependence in at-risk youth. In addition to basic research on the mechanisms that underlie eventual substance use disorder, her applied work is designed to marry existing infrastructures for substance use disorder treatment for parents with family-based preventative interventions to reinforce the recovery and reduce externalizing behaviors in their children. Given the actionable nature of this research, she founded and directs the National Prevention Science Coalition to Improve Lives, a large professional organization dedicated to the transfer of knowledge from science to practice in public health policies. As such, Dr. Fishbein has been intensely involved at the policy level in advising legislators, state and federal agencies, national organizations, and others regarding strategies shown to avert trajectories away from substance use disorder. She maintains that proactive strategies have been developed for early identification of the warning signs and preventing exposure to contributing conditions during childhood. On behalf of ADAPT, a huge thank you to Dr. Fishbein for being here with us today. I will now hand it over to you.
Thank you. Thank you so much. And I'm delighted to be here. Thank you to the organizers of this remarkable summit. And I want to especially thank the audience for hanging in there, given that I am the very last presenter of the day. I'll try to keep you awake. What I'm going to do is talk about normalization of prevention principles and practices. And, basically, I think the last several presentations at the summit have covered aspects of this and have really talked about how can we really begin to use prevention in a way that is part of our zeitgeist. Like, how can we really get it into the way we behave on a daily basis, and how policies and systems can be supportive of what we know works from the science of prevention. So I'm going to try to wrap some of that into it and maybe even go a little broader than that. And I want to just start by talking about what the field of prevention science has done, because what we really need to keep in mind when we talk about these topics is that we're trying to prevent negative trajectories, right? Trajectories to negative outcomes. And those negative outcomes can include a whole range of psychopathologies, including substance use disorder. But if we can normalize the developmental trajectory of children and adolescents, we can prevent a lot of these trajectories from going awry, and we can really help children to thrive and be successful adults. So although I'm going to talk a lot about children and adolescents and the way we interact with them, it's really all about making sure that they're developing in a way that's healthy, that they can have well-being, and again, be successful adults. And that includes not engaging in substance use. So just as a quick refresher, this is the really truncated list of a few things that 40 years of prevention science research has come up with. Obviously, it's scads long, but I just want to focus in on some of the major things that we now know from this field. And that is that the problems that underlie all risk behaviors, all kinds of psychopathology, again, including substance use, involve poor self-regulation. And what we've learned is that they're preventable. It is preventable, that self-regulation can be reinforced. It can be, it can be really strengthened so that, for better resilience and coping skills and good cognitive function and ability to do well in school and so on and so forth. So that's number one. And we also know that adversity, inequities and inequalities across communities and society, stress, and I mean high levels of stress, and trauma are often root causes of poor self-regulation. And both the risk factors themselves, which include things that we're exposed to, like the adversities, like the structural factors, like the way in which we are raised in our neighborhoods and in our homes. Those are where the risk factors often come from, and their negative impacts, which have a tendency to have an impact on dysregulation, are preventable if they're appropriately addressed, as I had just said. The field has also come up with dozens of evidence-based programs for the prenatal period through adolescence and emerging adulthood that have been shown to be successful in doing exactly this. And we know that programs work best when they're mapped to underlying mechanisms of the phenomena we wish to prevent. So we don't want to just look at this distal outcome of substance use. We have to look much earlier in the child's development to see what's going on that might be leading to that tendency. And we finally know that these interventions are particularly impactful for children and adolescents who are disadvantaged. So what we really want to do here in this presentation, but across the board, is we want to bring into play what we've learned throughout these decades of research and prevention science. And by bringing them into play, I mean really, applying them in our daily lives, applying them in policies and systems and practices and so forth. Now, one of the tables that are the graphics that was already shown is this one. And I just wanted to show it again because it reinforces what was discussed previously by Dr. Biglin, is that we do have interventions across the lifespan that have been shown to work. And they occur at these different levels. So prenatal care, the prenatal period, infancy, and so forth, all the way through school, community, family interventions, but also including community interventions and policies. So I really wanted to draw this out because I'm going to be talking later in my talk. I'm going to bring into play how we can normalize these different sectors of our society to ensure that we have healthy development of our children. So what is the bread and butter of prevention? Prevention research has been historically focused on the development, implementation, and scaling of interventions. So you've kind of already gotten a sense of that, but prevention research started out by saying, how do we develop interventions that we know are going to work, that are going to focus on the important risk factors and the prevailing conditions in which children live and develop and so on. And so let's develop programs that kind of map to what we know could be causal agents in a negative trajectory. And then after these interventions have been developed, how do we implement them properly? Because if we don't have good implementation, you can have a fantastic evidence-based intervention, but it's not going to work, right? So you have to have really strong implementation and fidelity. And once you have that, then we can begin to scale these interventions so that they can benefit more people, different communities, different cultures, different situations, different types of populations. So prevention science is really focused a lot on that. And I must say that the success of this agenda is really remarkable. The gains that have been achieved in preventing negative outcomes are really substantial across the board. And this is something really to be celebrated. And it isn't celebrated enough. And so that's why we're so happy that this audience in particular is so engaged with this topic. Increasing and sustaining these impacts can be achieved basically in two ways. We can broaden the scope and the scale of the interventions that we have so that they can, achieve larger effects for more people across different communities and so forth. And the other way we can do it is by identifying or developing the effective methods that can help us to institutionalize the programs that are most effective and most generalizable, that work for the most people. So if we can determine, this is another type of research that's going on, if we can determine how we can institutionalize these programs so that they're not coming and going with the researcher, coming and going with the grants, but really embed them into curricula, really embed them into homes, really embed them into systems, then they're going to be much more impactful on a population level rather than just a small district or a small community or whatever else. The big constraint for us, and as a researcher, I have to say it's a huge constraint, is that the reality of the situation is that the research process is largely dictated by time limited grants. So when we go in to do a school-based intervention, we usually have funding. It might be from the federal government, it might be from foundations, but regardless, it might be 3 years, 5 years, and then it ends, and then we're on to the next bit of research. And so we're not really sustaining it. I've had, school systems say to me, where are you going? Where are you going? This is working so well. I'm not the interventionist, by the way. I do the research on how things are working and for whom. But, as part of the lead on the research team, I can't stand having to walk out of a school district and say, well, we don't have any more money to continue this. So that's why my heart is now in normalization. How can we really embed these to be sustained more carefully and continuously? So that's why today I'm going to talk about the culture of prevention, which is what we otherwise know as normalizing prevention practices. And what we want is for these practices to become a normal part of life, so that we're engaging in proven strategies that have been researched and found to be effective, proven strategies that enable families to be healthy, and that we can apply the principles that we've identified across time by prevention science, that if we embrace on a public health level, on that kind of a platform, it can permeate potentially all of society. That is the hope, that is the dream. In order to do that, though, so it's not just individual uptake by these practices, it's more than that. They need to be supported by policies. These principles need to be understood by the public, and they need to be carried out by parents and provided for in communities. So that's like a lot of levels that we need to reach with these practices and principles. They are then set in motion by a culture, by an environment that's supportive, that enables caregivers to be nurturing. If our society is not nurturing of our caregivers, it's very difficult for our caregivers to do the same with their own families. So it's a reciprocal process here. And if we can accomplish this, we can enable children to reach their potential. We can enable them to develop and thrive and be healthy. And all of this involves the embedding of these practices, not just in our homes and communities and policies, but we also have to think of the ways in which our systems are interacting with our families and with our children. So our child welfare systems, our foster care systems, right? Healthcare, primary healthcare, pediatrics, and so forth, juvenile justice, criminal justice, our educational system, and so forth. So it's really important that we have a communication pipeline from researchers, practitioners, and community coalitions to policymakers at all levels, state, federal, local, and so forth. Because that's where we have the potential to exert an impact where the rubber meets the road, by communicating the science and these best practices to constituents, if you will. But it's also important, I have to say, it's very important that at the same time, in tandem, we need to hear from the constituents. These cannot be researchers and policymakers telling communities what to do. Culture of prevention means that the communities have a voice, an integral voice. And that's why I call out the need for community coalitions and so forth that can help speak for these communities who have their own needs. Okay, so now I'm going to show you something some of you may have seen before, but I love it and it helps me make my point. So I'm going to show it to you and hope that you get something out of it, even if it's the third or fourth time that you've watched it. So I'm going to show you an upstream analogy. It's a public health parable. And this is a very key concept in public health perspectives that has direct input to what we're talking about prevention science generally and today in this. Okay, so with that, now I'm gonna like apply that directly to what we're talking about with respect to different aspects of prevention. So with this public health parable, what I've illustrated here as best I could with my little drawings, is that that we can prevent substance use disorder in multiple ways. If you look downstream, and this is not where we want to reach people, right? Looking downstream, what we have here is a triaging kind of approach. It's about prevention, it's about chronic problem management, and it's here where we're really focusing more on the deep enders, right? So do we really, yes, we still need this, but we don't want to put all our eggs in that basket. If you look a little bit more upstream, we're talking about inoculating high-risk populations. And here we modify individual behavior, or we modify the conditions under which children and adolescents and families are living. So we might be focusing on conduct problems, the early signs of conduct problems, the early stages of drug use initiation, high school graduation. How do we boost that? How do we engage in violence prevention? How do we invest in maternal health, parenting supports, and so forth? So that's where we're at with inoculating. A little bit further up, we have promoting resilience, where we're really systematically delivering programs or their components to increase awareness, to educate, to encourage adoption of these programs, and also change mindsets so that we can enrich our daily interactions with each other and with our young people and so forth. And so, but here, even close to the top of the river, when we say promote resilience, we're still dealing with adverse conditions, because to be resilient means you're resilient against something. You're resilient against adversity. So we still need to do some work at the population level, which is why normalizing prevention here at the top of the screen is where we can address the social determinants of health. These are the conditions under which people are born, grow, live, work, and play, and we can reduce exposures to the detrimental influences at the outset. And so here is where here's really the promise of prevention. And I think every stage is needed, but we want to ask ourselves, where do we want to invest in most heavily? Okay, so 2 approaches to normalizing prevention. Another simplification, but I need that for only 45 minutes. The first approach to normalizing is to target entire communities. I will call out here now Dean Dixon, who is an absolute expert in this area, as is Will Aldrich. Certainly can send you resources for them. But they are the luminaries and with respect to how to target entire communities. We want to scale and strengthen interventions and work on the implementation process and be sure that everything is there. And we can focus also on the active ingredients of interventions in doing so. But what I'm going to talk more about is the second aspect, which is reforming universal social systems. And some of this will sound familiar because Nat Kendall Taylor and others are talking about changing minds. We're also talking about changing minds, but as I always say, we're talking about changing the way we interact with each other, we're changing systems, and we're changing policies. And we need it at all levels in order to really normalize prevention. Here are a couple of drivers of normalization, also referred to by some of the previous talks. It's absolutely essential that we increase knowledge. We need to be able to change attitudes and our mindsets based on our understanding of the science of human development and the fundamental importance of the way adults interact with each other and their children. Children don't grow up in a vacuum. Everything that we do, every interaction we have with our children is essential to their development. And we need to think of it in those terms. If we're parents and we're constantly on our phones and we're not responding to our children's overtures, if we're not responding to our babies' faces and so forth, that has an impact. Everything all the way through child development has an impact. So we need to think very carefully about that. And I think that if we can make the knowledge that we've amassed from the neurosciences, from developmental psychology, from epidemiology, all across these different disciplines, if we can make that science accessible in the way that Nat Kendall Taylor had described, make it accessible, it can facilitate change in attitude, and then we hope behaviors will follow suit. And then once people have this information, those recipients of the information become the change agents, and they share it with their associates and the organizations that they interact with and the systems that they work in, and they will then disseminate it throughout their own spheres of influence. So the end goal here is to kind of motivate a shift in cultures and priorities and practices so that we can in turn influence our policies and the way we invest our resources and the relationships between our systems. Like I mentioned, all those systems, child welfare, juvenile justice, education, healthcare, they need to talk to each other in order to really ensure that we're, focusing on every dimension, every domain that's relevant to child development. So the second driver of normalization is to then incorporate what we've learned, those practices and principles that can actually drive intervention impacts into our daily lives, like to really embed them into our daily lives. And doing this can transform, and I say this a lot, I realize, but we can transform the way adults interact with each other, because children model what they see, and with each other and with their children inside. And so these fundamental units of interventions have been shown experimentally to influence specific behaviors. And I take you right back to Dr. Biglin and Dr. Embry's presentation that talked about those very fundamental units, those kernels, those fine-grained practices that have been shown experimentally to influence our behavior. And then we want to integrate a wide range of these practices and principles into our interactions. That has more potential to broadly and sustainably promote health and well-being independently of a particular intervention or of a particular grant. So we get away a little bit from the limitations of the research process, and we get more into what it's like to have a cultural intervention. And the ultimate effects will be to create a more equitable playing field for all children. These active ingredients then need to be embedded. As I said before, they're active ingredients. They're shown to be most potent in interventions that have been shown to be effective in reducing substance use disorder and other kinds of mental health and behavioral health problems. These kernels, practices, the program components can be incorporated into our daily lives, into our mindsets, and into the way systems function. So sort of a little bit of a summary here, but I also want to point out that we can do this to the extent to which we've identified them and their ability to impact child development and so forth. But we also have to recognize that more research is needed, and that the idea of looking at these active ingredients has only really become a prominent research focus recently with strategies such as SMART designs and the MOST design. I'm talking research, but that are really geared towards identifying what those program components are, what's really working, so we can optimize interventions, but also so we can pull them out and use them in our daily living. Okay, so, and we know these active ingredients obviously are adaptable to multiple settings because they can basically be deployed anywhere. And they're also accommodating of our cultural and community differences, characteristics, preferences, and needs. So they can morph depending on what any given community needs and wants. And they're also infinitely adoptable, not only by individuals, but they can be taken up at the systems level with child welfare systems, for example, really understanding what kinds of practices help to bring out the best in children, and develop foster care systems that are really nurturing, that enable children in these systems to thrive. And then finally, they have potential, these active ingredients, and normalization has the potential to exert population effect, level effects more so than single interventions. Okay, so now I'm going to talk about from home to school to community. And I'm going to start with home. And I'm just going to give you some exemplars of these approaches that are most impressive and have the most enduring effects. I'm going to start with the Absendarian approach, long name. This Absendarian approach was developed in North Carolina and has been used for 40 years. 40 years of research that has shown that the quality of adult-child interactions, which we call serve and return, I believe that Dr. Kendall Taylor coined this phrase with the Harvard Center on the Developing Child. I hope I'm right, but it's called serve and return between a parent, this reciprocal process between a parent and a child, as frequent and intentional occurrences in 4 different contexts. And those 4 contexts are language priority, prioritizing language within the home, enriched caregiving, conversational reading, and learning games. And okay, so that seems sort of like a no-brainer, but what the Absendarian approach offers are very specific kinds of ingredients and practices. And what you see here is just, a summary of what they are. And there's wonderful work out there. There are also manuals that can be followed and booklets that can be used as a how-to for providers, for practitioners to help the families that they work with engage in these practices. So I'm not going to go into the nitty-gritty detail of it, but just to know that each of these 4 domains, 4 contexts, are very enriched with respect to the types of specific practices that have been shown to do this, that over time you can see developmentally and through into the high school years, and actually the research goes well beyond that, that there's much less psychopathology. There's more high school graduation. There's less substance use and so forth. So all along the developmental timeline, children are benefiting from having received the Absendarian approach. So, and okay, here's what we've learned about caregiver practices to promote self-regulation later in life, especially in adolescence. And I don't know how many of you are parents. Raise your hand. I can't see any of you. But I wish that that I had access to some of these things when I was raising my teenagers. I'm just kidding, they're fine. But if they watch this, they'll be upset with me. But these are very specific ingredients of ways in which we should interact with our children. And you think, well, of course you should be warm and responsive. Of course you should provide consistent routines and structure and so forth. But, it differs as to what age the child is, as to what kind of strategies you use. And there are very particular practices that are engaged at different developmental stages that can lead to a healthy adolescent that has the skills and self-regulation to not engage in substance use. So these are just examples of some things that can be done in the home. Okay, so we're talking about home-based normalization of ways that we can teach children to develop their own self-regulation. Within each of these is a whole bunch of kernels that I'm not showing you because you have to dig in further. But again, I have a lot of really great manualized type literature on this. So what about schools? So I really want to call out my good colleague, Dr. Laura Jana's book that really talks about the first 5 years of life as being critical to skill development, given the developmental plasticity of the brain and readiness of children to learn social competency and social emotional skills really early so that they can be prepared to enter society and even enter the workforce with the skills that they'll need to succeed. And so what Dr. Jana does is focus on social emotional learning in the first 5 years of life. that can make a world of difference from, all across the lifespan. As you see here, each dollar invested in this type of skill building can have a return of $11 in benefits and prepares children to be effective. So what the toddler brain describes, she's a pediatrician, by the way, with a very strong background in neuroscience. She talks about the ways that parents, teachers, and child-serving organizations can be agents of change through high impact and scalable interventions, scalable evidence-based programs that foster good health, well-being, and positive outcomes. But what is different, because this sounds like, okay, this is like there's a lot of books out there like that. But the ways in which this is different is that she really brings into play the systems that our children eventually need to interact with, and ways in which some of these sectors in our society can help parents and support them in bolstering these skills in their children. And so she talks a lot about the role that industry and businesses can play. She talks about the way the media can really make a difference. I'm going to talk about that also in a few minutes. Childcare and early learning care centers, how they can be better equipped, and as well state and federal government, so that we can overcome some of the structural barriers that we currently have to implementing and scaling these kinds of practices. So there's really a need to increase this scientific understanding in all of these areas. In terms of thinking along these lines, we came up with this model a few years ago that we're calling future proofing, because we're thinking ahead. We're thinking to a child's ability not only to have self-regulation through adolescence, but actually get into the workforce. And the workforce is very damaging. The workforce is very demanding. And so in this day and age, we call it the economic or the innovation economy. And so how can we prepare children better to, make their way, slide through and really be effective? And so, because we often overlook these really early skills that I have here all the way to the left, we often overlook the ways that, they affect multiple domains of functioning across life. So if we can develop these competencies really early, we can, again, strengthen resiliency, help them to cope with all sorts of challenges that they have throughout their lives, avoid drug use and conduct problems, and avoid addiction as adults. So we want to nurture the building blocks. These are building blocks to the left for more complex social competency skills that can lead to better all sorts of things that are listed in that second column to the left there. And so, we know all this, right? But it has yet to become a mainstream component in educational curricula, which is why I have this in the school domain. It is not embedded in our educational curricula. And we miss such a wonderful opportunity to instill these skills in children. And ultimately, I'm going to go back to not Kendall Taylor's term, but I use it a lot, to build a robust brain architecture. And so this is needed throughout all of our systems. So, okay, next, community-wide normalization strategies. I'm going to speed it up a little bit. So first, reducing stigma. I'm just going to mention the reduction of stigma about substance use disorder from a community-wide perspective is one way that we can help people to seek treatment more often, to be more amenable to talking openly about issues, for parents to seek help with when they have children with conduct disorder or children that are beginning to use substances. Reducing stigma is absolutely necessary to really helping to bring people into the fray, into a welcoming fray, if you will, that will help them, just be able to embrace these principles and help their children thrive. So just a quick mention of that. And then media coverage. There's a little bit of a delay here. So this is a 9-year-old girl who watched her father stab to death her mother. several years ago. The media reported it. When they reported it, they said, but the girl is fine. The girl is not fine. The girl has experienced one of the most horrific traumas of her life, and it will affect her for her life. And so when I talk about community-wide normalizing strategies, this has to permeate the media. The media has to understand the impact of trauma on the developing brain, and actually on all of our brains, right? But especially when children are growing up and they're sensitive to environmental inputs. So we need to get through the media. That includes commercials, social media, and so forth. So that is one way to use a community-wide normalizing strategy. Another has to do with education. We want to instill the building blocks, sorry for the EF, it's executive function. We want to instill executive function in cognitive skills really early in life and build on them over time so that they are able, the children do have that self-regulation, because it's executive skills that undergird self-regulatory skills, right? So it's really important. I also think that we should consider teaching parenting in middle school before children have children, so that they can understand what all the rigors are involved with parenting. Value-free parenting in middle school is one way to prevent teenage pregnancy, and to ensure that our children feel supported and have the skills to parent when they are ready. And another is education about addiction. I have to say, in general, children, and to this day, are not educated about their brains in general. And they learn a little bit about nutrition. They might, learn a little bit about, some health issues when they're in school. But the brain is the major driver of everything. And we should consider educating our children about brains and how to take care of our own brains. I think that would make a world of difference. And then finally, community-wide normalizing strategies to train, in some respects, these are all our first responders, teachers, mental health providers, primary care providers, first responders, judges, and district attorneys. They're sort of all our first responders, and that those are the people that interact with our children, and they provide, scaffolding for families. I have law enforcement here because there are initiatives out now to help train law enforcement in understanding, understanding mental health, understanding what mental illness looks like, how to respond to it, what to do when you're in a crisis situation, a child has been affected by trauma. So I think it's a very important educational target for us. And I also want to mention that in North Carolina, the Chief Justices in North Carolina has developed a task force on adverse childhood experiences informed courts, so that our entire judicial system can be informed about ACEs and the impacts on children and families. Going next to, there's a little bit of delay with this one, so I don't want to click again. Going next to society, and I'll just mention quickly, and I am getting towards the very end, so hopefully I'm not going to go over. But the Parent Nation, okay, so another colleague, Dr. Dana Susskind, I don't normally call out all the books of my colleagues, but they're so instrumental. They're instrumental in my own thinking, and they're instrumental in helping us understand how we can embrace this prevention framework from a normalizing perspective. So Dr. Susskind has a book coming out in April of 2022 to really look for. It can help to do a great deal in kind of raising to the national consciousness around the need to prevent cognitive disparities that and the host of resulting inequities that occur as a result of these disparities that can follow a child into adulthood and actually throughout life. So it's called A Parent Nation, and she talks about, healthy brain development to kind of lay out a roadmap toward healthy brain development and a future where every child has an opportunity to fulfill their potential. And her prescription is actually more robust support for parents, which is a part of, critical years. What basically she says is that there's this disconnect between what we know from neuroscience and the other sciences and what we've actually done to provide the support that parents need at the most critical time of childhood. And she talks about the first 3 to 5 years of life as well. And that, that's when the child's brain continues to develop through adolescence, almost to age 30, believe it or not. We won't go into that. I'm always telling my kids that your brain isn't fully developed yet. But, we want to be able to strengthen those neural connections really early. But but we don't provide any support to our parents in helping them to do that, and in providing those supports that are needed from childcare, from educational systems, from our governmental systems and so forth. Parents are kind of left on their own at a time when, their brains, their child's brains are really vulnerable, but also little sponges. And so we'll see this as an opportunity as opposed to vulnerability, as per Dr. Kendall Taylor. So, again, it's a roadmap. How can society do this? She talks about what the needs are. They need easily acquired basic knowledge about how best to foster neural connections in their children. Parents need time with their children to nurture their connections. This is about policy, right? They need high quality childcare that complements those efforts. And they need to be able to provide children with stress-free homes. And finally, we need support for this really formidable task from employers, communities, and policymakers. So I'm going to go through this, but these are some, kernels, if you will, about how, what she indicates needs to be done from a policy perspective. And lastly, I want to mention this because this is a tremendous initiative. Nat Kendall Taylor has done a lot with these folks. He mentioned Alberta. This is the Alberta Family Wellness Initiative that I also work with. They have developed educational materials that they have rolled out to the entire Alberta province. And Nat's group has helped to effectuate that process and get this information out in a way that's accessible to their population. And so the idea is to take the science of the brain, understanding of the brain and how it relates to mental health and how it relates to addiction, and help people to understand what does trauma do, what does stress do to the brain, and how is that manifested? How do we see it early in life? What do we do in terms of intervention? How do we react? Where's the, how do we detect it early and intervene in a way that is nurturing to children, that can get them off that pathway to help nurture the brain and so forth. But it's really about, like it says here, fostering communities of purpose so that we don't have the issues of negative prevailing conditions in the first place, so that the trauma isn't there in the first place, and that we bring all these systems together, including the public, to mobilize that knowledge and help the public to actually alter the way they react to each other. Again, the individual interactions are just so important here. And so this is truly the embodiment of the culture of prevention. We are working with them. We now have CEUs that we can provide to people who take the course called The Brain Story that has been launched for years now by the Alberta Family Wellness and the Pelix Foundation in collaboration with the Harvard Center on the Developing Child. And we in the United States, through my organization, the National Prevention Science Coalition, can provide CEUs to people who take this curriculum. So be just thrilled if anybody was interested. So we're really trying to gear this up in the United States. And then I guess I think I'm a little late, so I think I will just wrap up. And this is just an example of how this works from a system level. And actually, let me just mention with this last slide that what this does it enables a bottom up. So we talked a lot about the top down approach to policies and systems supporting people in their communities. But what this does is says, well, wait a minute, because the change agents can also be the public. It can also come from our own development and training. It can come from our frontline practices of our providers and our practitioners and clinicians and educators and so forth. So we want to be able to, have that ability to control our own story in collaboration with policymakers and the systems, our governmental systems. So it's really, they call it a downstream focus here on the right, but it's the two working together, right? So that you really have full spectrum prevention. And then lastly, I just want to call your attention to this report. I don't know if the other speakers referred to it or not, maybe when I was in the room, but the National Academy of Sciences, Engineering, and Medicine, the 2019, I think Tony showed you 2009, their 10-year report, it has been out for a couple of years. It just frames everything so beautifully. It provides a very detailed roadmap of the full spectrum of prevention science, and how we can, create, healthy environments through a national agenda. So that's how it ends, with a national agenda. Tony Biglin helped write this. I hope all of you will have a chance to look at it. It's a tremendous resource. So I'm going to stop there and hope I haven't run over.
Dr. Fishbein, you're doing great with time. You've actually got a few minutes for questions.
Okay.
Yes, thank you for that. We've had a few questions come in. The first one, you mentioned a brain training recently in your presentation. How can someone access that?
Okay, the brain story that I just talked about is, you can access that on their website, and I can put it in the chat maybe if I can get to it quickly enough. But if you want CEUs for it, just go through our website, which is www.npscoalition.org. npscoalition.org. And that might be the easiest way, or just email me.
Okay, and if we've got your coalition's web address, and if you'd like to send anything else on that, we're happy to send that out to all participants in today's session. Okay, the next question is related to parenting education and a public health approach to parenting education. Do you think, in your opinion, especially as president of the National Prevention Science Coalition, right? Should the CDC and other healthcare organizations, or really other organizations at large, be working on a new kind of national public health approach involving parenting education that reaches everyone, everywhere?
I assume that you're asking for my opinion. And yes, a lot of us are thinking along those lines. Because it's part of a full spectrum of support for parents, but also, helping to, start early. Like, if we can begin to educate our children very early about what parenting involves and how important it is to nurture, healthy brain development, healthy child development across the spectrum, then I think that we can avoid a lot of the tertiary approaches that we have to do now because we didn't intervene early. So I see it as more of a public health strategy, a larger public health strategy to begin that sort of education.
Yeah, absolutely. And that aligns very well with what Dr. Sloboda was mentioning earlier, as well as Dr. Biglin and Dr. Embry. So it's nice to see all those ideas gel together at the conclusion here of the summit. We have another question that came in related to media coverage. Are you suggesting, and what you were explaining about media coverage a little earlier on, are you suggesting using the media to help get stories of traumatic experiences out there and help normalize the discussion of various traumas is beneficial? Or are you suggesting having the media reduce the sensationalization of those stories which they so often do, would be more beneficial. Can you speak to that?
Yeah, I would say a little bit of both. I would like them to be more responsible, which would require that they have some of the scientific knowledge that we're talking about imparted. You know, just having that background about the impacts of trauma, and being able to more responsibly report when there is a news story, rather than say the child is fine. Say the child is physically unscathed, and then maybe go on to say, but of course the effects of trauma will need to be attended to. You know, I'm not sure, it really depends on the story, but what I don't like is the normalization of children being exposed to trauma and then having the media say, but they're fine. You know, it just rubs the wrong way, and it does a world of damage, quite frankly. So I really think these educational approaches for all these aspects, for businesses, for employers, for, you know, for these different sectors of our society, child welfare and so forth that I mentioned, first responders and the media, have that education. And if we start early and people really do learn these things early, then it will automatically be infused into that narrative. So I think it's very important. And I'll just say on the side, if I have a moment, what the research is starting to show is that young children can be traumatized and appear to be fine mentally and behaviorally, not just physically. But the impacts of that trauma it appears, can impact the connections, the neural connections that do not yet form until adolescence. So as these neural connections are coming together in adolescence, the earlier impact may have caused, and I don't like to talk about damage because I don't like deficits models, but may have caused alterations in the way these neural circuits come together. And the self-regulation may not be what it should be. And then they look at the child and say, I don't know why there's a behavioral problem here, and not thinking that 10 years ago, the child experienced a trauma. So the neuroscience is showing that there can be delayed effects. The child may appear fine, but may not be, and may need attention, may need intervention.
Absolutely. Thank you for that, Dr. Fishbein. A lot of people may not know, but a lot of the information about National Prevention Science Coalition to Improve Lives is in the resource supplement. And if they are interested in getting connected with all of you, they can do so by reading that material. Also, I'm pretty sure that not everyone knows that we developed our technical webinar series with the experts that are from your coalition, your national coalition, and just such a wealth of expertise that can be found through all of you. We truly appreciate you bringing your insights to this particular summit, as you do with every summit, right, that we've held so far through ADAPT. And I think we're leaving today with this idea that we have a better understanding, we have better tools to be able to normalize prevention as something that can be seen more as a given, as opposed to an add-on of sorts, right? In the way that we approach substance use. Dr. Fishbein, thank you so much for joining us today. I'm going to wrap up this piece and hand it over to Deputy Director Jamie Delano to come up. If you would like to access any of the resources from today's summit, those can be found in the resource supplement. A link to that website should be posted here in the chat room for you all to access it. At that time. Okay, I'm being told that we actually will transition to the concluding remarks in a separate webinar link. So I'll go ahead and finish our final remarks from ADAPT before we go into that. I want to take this time after you have accessed your resource supplement and your summit slides, as well as the speaker biographies on the website. I just want to take this time to really thank the ADAPT team for putting this entire summit together. And I'm going to call them out specifically. Patty Fersazidis is our Assistant Director for ADAPT. Rebecca Bates is our Technical Assistance Project Manager. Megan Erickson is our Research Analyst. Julia Glockham, and you've met all these through the introductions today. Julia Glockham is our first Public Health, Public Safety Fellow, and Adiola Adioma is our Communications Graduate Assistant. All of them have worked tirelessly and effortlessly to make today happen, and you would not be here today. We all would not be here today without them. So a sincere thank you to all of them. A sincere thank you as well to all of our presenters. Many of them volunteer their time to come help us today raise our level of consciousness as we strive to do from the very beginning. We look forward to seeing you at next year's summit. And at this time, we're going to transition to the next link to hear from Deputy Director Jamie Delano as she concludes the HIDA Prevention Summit for 2021. Thank you.